everybody, it's me, Marion Yao, aka Miss Foot Fixer, and we have this very hard corn that's on the bottom of the foot. So this is the left-right foot here. I always get a bit confused with my left and right when I'm looking the opposite way. So we've just taken out the first layer of the thickened skin, and we can see the core of it right now. And what we're gonna do is just tilt our 15 blade. Yeah, fantastic. And we're just gonna go in and see if this will come out. It's very impacted. So cones are caused by pressure. So this patient loves running, and he says to me that he needs to get better footwear, which is great because he already knows how to fix his problem. So you probably want to have more cushioned shoes, wider toe box, laces or strap-on that secures the foot tight so it doesn't have excessive movement. Sometimes orthotics can help too. This is very compacted and all. Well done. Still at the head of it. The older the corn is, the more compact it is, and it doesn't want to come off in one circular lump. You can feel it. Well done. Once I'm done with this, I want a drill, small one, to go inside. Let me just do one. So we just, when we paused the camera to off screen, we just talked about silver nitrate. There's some evidence shows that silver nitrate can stop the callus from growing as fast. So we're going to put that into the middle of it. Obviously, one of the side effects of silver nitrate obviously is staining, but also you can have an allergic reaction to it. A little dash in her or anything too much, a little bit.